much. Also tonight, a little bit of a break now for state lawmakers after 30 days up at the Roundhouse. The governor said she ended, however, this legislative session both frustrated and cranky, possibly because a majority of her public safety bills did not pass.
But leaders who help some of our most vulnerable neighbors really feel the same way. And they say we wouldn't need all the public safety bills if we would just address the root issue. Cassie Foote has more of their reaction tonight. Cassie.
I talked with people who advocate for those with mental illness, including the National Alliance of Mental Illness and Serenity Mesa Youth Recovery Center. They say mental illness and crime go hand in hand, and if we prioritize behavioral health, everything else will fall in place.
It's no secret New Mexico has its share of issues. We heard about a lot of them during our 30-day session. Brandon Estrada says one issue missing from the discussion was mental illness.
In comparison to last year in the legislature, there was dozens of bills that revolved around mental illness, and this year there's probably less than 10 that specifically looked to address it.
Estrada is on the board for the local chapter of the National Alliance on Mental Illness, or NAMI. He says for right now, if you try to get an appointment for mental health treatment, you could be waiting 6 months to a year.
If they can't get that treatment in a timely manner, 6 months could be the meaning between life and death.
He says there were a couple successes this session, including bills focused on education and mental health awareness, and one to expand Medicaid reimbursement, but nothing to make a long-lasting impact.
If we could address behavioral health or mental illness, we could probably address about 99% of the problems of our society, including crime and violence.
David Burke agrees. He's the director of facilities and programming at Serenity Mesa Youth Recovery Center. They offer inpatient treatment and housing for people between 14 and 21.
Since the pandemic, we have seen a skyrocket in use across for all youth. And not just using little drugs. I mean, they're using really hardcore drugs. And one of the biggest things we get from our kids is they just don't feel like there's any hope.
He says one thing the teens and young adults have in common is mental health issues.
I think we had a huge surplus this year, and we had an opportunity to make real effective change in the mental health and substance abuse field, and it just didn't happen.
And he says if we're not helping with mental health resources, then we can't solve our crime problem.
If the governor does call a special session, it needs to be about mental health. It needs to be about the dirty, nitty-gritty part of dealing with stuff that we're afraid to deal with and we don't want to deal with.
Burke says a bill he was happy to see pass in the legislature is one helping veterans grappling with suicide. He wants to see the state offer more incentives for psychiatrists and therapists to come work here. $97 million in the state's new budget will go toward Medicaid reimbursement to hospitals to meet needs, including behavioral health. Estrada says that is a good start because it helps the current providers, but it may not do much to bring more providers to the state. Tessa, Trevor?
All right, Cassie, thank you.